Good morning, everybody. Oh, that is not true. Good afternoon. Hang on, let's start again. Good afternoon, everybody. My name is Allison Delcalzo-Behrens, and I am an HIV counselor at the Family Health Center of Morristown Medical Center and the chair of the Morris County Community Assistance Services Committee. Today's webinar is Homelessness Prevention Programs. The Coronavirus Aid, Relief, and Economic Securities Act was signed into law by President Trump on March 27th, providing more than $12 billion in funding for HUD programs, like the Emergency Solutions Grant Program. State and local governments are receiving more funding than ever before to prevent homelessness in response to the coronavirus. In this webinar, we will learn more about current homelessness prevention resources at the local and state level. Before we start, there are a few housekeeping items I would like to review. The first is that this webinar is being recorded and will be uploaded to the CAST YouTube channel. The second is that comments or questions are welcome. You can enter them into the chat, or if you are connected to audio and you're not interrupting the presentation, you are invited to make comments or ask questions through audio. Please just remember that we are recording, and please keep yourself on mute when you're not speaking. I'm about to take everybody off of my mute, so please put yourself on mute at that time. I would now like to introduce today's first presenter. Nadine Azari has been at Monarch Housing Associates since January of 2019, when she assisted with data analysis for the point-in-time count. In July of 2019, she started full-time as a consultant, working with almost all COCs in northern New Jersey. Welcome, Nadine.
Thank you so much. So I just wanted to give you all a disclaimer. I have a dog. I hope he doesn't bark in the background because he's been doing that a lot lately. But thank you for joining us. Just to give you a brief overview of today's presentation, I'm going to be talking about homeless prevention programs more broadly and how. Do you guys hear that echo?
Yep, that is Maria's vehicle. Maria, just mute yourself, please.
Okay, perfect. So I'm going to be talking about homeless prevention programs more broadly and how ESG funds can be used. And then we're going to have Sara and Stephany talking about DCA homelessness prevention programs, which have their own set of regulations and eligibility criteria. So let's begin. What is homelessness prevention? So it's exactly what it sounds like. Refers to policies, practices, and interventions that reduce the likelihood that someone will experience homelessness. And there are three types: primary, which aim to reduce individual and structural risk factors that contribute to homelessness and increase protective factors. And there are three types of primary prevention strategies: universal, which would basically be having more affordable housing, increasing people's income. There's selected group and then indicated group. And then there's secondary, which this whole presentation is about. And then there is tertiary homelessness prevention, which supports individuals and families who have experienced homelessness to ensure it doesn't happen again. So like I said, most of the time we're referring to secondary prevention. And the goal is commonly referred to as diversion, and it provides a safe alternative for people who are seeking shelter or are moving to an unsheltered location. It prevents prolonged experiences of homelessness and avoids unnecessary shelter stays. And the target population are people who are right about to enter the homeless response system. And then I listed a couple of examples there. So we really should be targeting prevention that is effective and efficient. So effective meaning we help people find and maintain stable housing and avoid homelessness, and efficient meaning we have interventions that assist people who would experience homelessness in its absence. So I think what's really important here is the efficient. So who are we really serving when we want to prevent people from entering our system? So I pulled a lot of these slides from HUD's webinar on homelessness prevention, which I linked in a couple of slides, so you guys can access that too. But it's important to identify both risk and protective factors to be efficient with indicated group strategies. So what basically that's saying is having a targeted population so that you're not wasting, but using all of your homelessness prevention dollars. I was reading somewhere that in Texas, as soon as they opened up their homelessness prevention assistance, I think it was gone within not like very soon, within a couple of minutes, all of the money had been used up. So what we're really trying to do is target our interventions to people who will become homeless without him. And that's going to prolong our resources in doing that. So this is from HUD's research on who is most likely to become homeless. So households who have eviction proceedings initiated, families with young heads of households, households in doubled up situations, households with an eviction threat, people who are exiting institutions, and individuals who age out of foster care. And I will say this, most homelessness prevention programs that we think of are just eviction prevention, which is great and of course does lots of good. But we have to think, would these people have entered our system if we had not given them this assistance? And the answer a lot of times I think is no. So maybe before they access homelessness prevention resources, there's a family member who can loan them money. Maybe they can stay with their friend if they're evicted. So eviction prevention is not necessarily the answer. And research conducted by HUD actually showed that overcrowding and being doubled up was the #1 factor that leads to homelessness. And this is even reflected in our own data. So if you look at our point in time data from last year, after drug and alcohol abuse, the #1 cause of homelessness was being asked to leave a shared residence. And I think that number is likely higher because all of these here, loss or reduction of benefits, job income loss, eviction, these could have all led to living with someone. So this number is likely higher. But that's even backed by HUD, that people are most likely doubled up. And if we're doing just eviction prevention, we know that we're not catching people where we need to, if that makes sense. So let's move on to the next slide. Where do we get money for homelessness prevention? So we could use COC dollars, but that's only for COCs that are identified as a high-performing community, which Morris is not. I think to be a high-performing community, we need to have a mean length of time homeless that's less than 20 days and a rate of return to homelessness that's less than 5%. And basically what that does is if you're designated as a high-performing community, it opens up the definition of homeless to include at-risk of homelessness for all of your COC-funded programs. You could also get homelessness prevention dollars through ESG and CDBG allocations to entitlement communities, and then also through DCA, which we'll be talking about a little bit more. So the CARES Act allocations. So when I was on this slide and we were talking about these allocations, HUD has a formula that makes a community an entitlement community, and Morris is one of them. And so this first chunk of money that Morris is receiving in the CARES Act, that's with the normal formula. But the second 1.49 million, HUD made a new formula specific for COVID, and that's why that increased so much. And you can see the same with New Jersey. So if you are wondering why I spent the first couple of slides talking about the basis of a good homelessness prevention program, it's because in this CARES Act allocation, Morris got around $2 million, which means flexibility in creating a homelessness prevention program that is less strict than what the DCA puts out with this chunk of money right here. I think it's around 38 million. And I just wanted to make another disclaimer. I'm of course not with Morris County, and I'm not sure how they're planning on using the funds. I just wanted to explain some things you could possibly do with ESG dollars through homelessness prevention. So eligible expenses under homelessness prevention. And again, this is HUD ESG. And I didn't break down CDBG because I just wanted to focus on ESG for this. So ESG homelessness prevention dollars may be provided to individuals and families who meet the criteria under the at-risk of homelessness definition and have an annual income below 30% of median family income. And this actually increased to 50% through the CARES Act, just with this pot of money. So I will go over that income limit in a couple of slides. So you can see here, these are the eligible activities. There's short-term rental assistance, which is up to 3 months, medium term, which is up to 24 months, and then rental arrears. And then under the housing relocation and stabilization services budget line item, there's financial assistance and services costs. So financial assistance could be rental application fees, security deposits, last month's rent, utility deposits, utility payments, moving costs. And then there's the services here: mediation, legal services, credit repair, housing search and placement. So I know I threw a lot of information at you, so I just wanted to give you all an example of a targeted homelessness prevention program. And again, this was discussed at HUD's webinar last week, so you guys can look at that webinar too. And this is actually based on a real program in Montgomery County, Pennsylvania, where they had a court-based eviction prevention program. And I think the most important thing to target, highlight here is that it was geographically targeted. And I believe in the webinar, what they were saying was they really took a look at their data, which I think is really important with homelessness prevention. And they found where people were being evicted most and where they were entering the system. And they narrowed it down to one specific town, I believe. So they based their whole eviction program out of where people were entering the system most. And they partnered with the local bar association, legal aid, court administration, and then social services. And I think the budget was around $160,000, and so they planned on serving 120 households. And I also wanted to point out here that this could be, you could also look at this homelessness prevention program through a racially equitable lens. If you target your homelessness prevention area, a prevention program in an area that is predominantly Black and Indigenous people of color. So just an idea. And I think in this example that I'm giving you, they also saw that it was racially equitable because of where the program was located. So the program was called Eviction Prevention and Intervention Coalition, or EPIC. And again, that was in Montgomery County. So what had happened was they had someone from a lawyer in the court, and they would just screen people if they had their court hearing that day, and if they could help them, they would help them. And I think what's really interesting is they kind of married like legal services and social services to make this really effective. So they even offered CLEs, or continuing legal education courses, for lawyers that signed up for a shift. And with social services, they had case managers, they had financial assistance of up to $1,500, data entry into HIMIS, and follow-up for 30 days. And it was found to be really effective. And again, the HUD webinar goes into all of this in depth. And they did not use ESG dollars with this. I think this was privately funded, but this would all be eligible under these costs right here. So that's just an example of ESG dollars. And now we wanted to go into DCA funded homelessness prevention programs. Before I hand it off to Sara and Stephany, I wanted to go over what the DCA released yesterday. And that's the COVID-19 Emergency Rental Assistance Program. So this is the $100 million that the state has set aside for short-term rental assistance. And I'm sure you heard that 20% is specifically for homeless households. So this is what this presentation is. These couple of slides is only for the 80%. That's for non-homeless households, because I'm not sure the state knows what they're doing with that 20% for the homeless. So this program is providing temporary rental assistance to low and moderate income households that have had a substantial reduction in income or became unemployed due to the coronavirus. And applicants could be eligible for up to 6 months, and they'll be reassessed at 3 months. So it's going to be through an online lottery process that I believe is opening on July 6th at 9 a.m. and closing at on Friday, July 10th at 5 p.m. And the person has to have an income that is below or at the maximum income limit, be a New Jersey resident, and their rent must be current as of March of 2020. They must have had a substantial reduction in income and a lack of assets or savings to pay rent, and they'll pay a minimum of 30% of their income towards rent. And again, this is a lottery, so it's not guaranteed if they apply. So for Morris, these would be the income limits, and I'll send out these slides so you have these numbers. And then this is the link where people could apply. And again, that's starting, that open enrollment is from July 6th to July 10th. And then this website gives you a little bit more information if you guys are interested. And now I will hand it over to, I believe, Sara.
So yes, Sara is from Norwescap. She is the Homeless Prevention Program Representative. And you are not on mute. So Sara, please give us an overview of your program.
Okay, I covered several programs, but we're concentrating on the homelessness prevention for Morris County. Usually this homelessness prevention, we have to have, the first requirement of the program is that they have to have a court eviction. Because of the pandemic, they have decided as of last month, I think, that they will, in lieu of the court eviction, because of the moratorium, that no one is getting evicted. So they said, have the landlords fill out a certification of arrears filled out by the landlord, where if they only owe 3 months, then we would be able to provide them with assistance as long as they meet all the criteria. So the criteria, the requirements of this, so we could pay up to 3 months in arrears and 3 months late fees. For example, we could pay for April, May, and June currently for those that fell behind, and 3 months late fees. And maybe May, June, and July, because this program specifically ends July 31st. So these are the requirements that they have established. They have to have a legal status, legal immigration status. They have to be between 80% of the AMI, and I provided a chart so you could, check that out. Must be able to demonstrate, so that's the chart there, and must be able to demonstrate that they will be able to, they had an economic hardship due to the COVID-19. So they will be looking at, after March 17, what happened. Must be able to afford to pay the rent going forward. So let's suppose they have all these requirements, but they can't meet the affordability, then we would not be able to consider them at that time. Maybe later on, but at that time that we're looking at their application. Applicant must have been paid rent up to March 31st. So the first month that we said would be April 1st. The applicant must have a current lease and have been living at the residence prior to January 1st. Looking back at those 3 months, they have a 3-month rule. So they have to have been living there at least. So I had an individual that moved in January and fell behind in February. So we are not able to provide him assistance as of now. And we talked about the certification of landlord of arrears. So right now, no eviction is necessary until July 31st. Okay, next slide. And that's the income. And then proof of hardship. Applicants must prove that they had a reduction in the overall income because of COVID. So example, I had an individual that she was already on unemployment, and she would not qualify because she started unemployment in February, for example. They would need to provide pay stubs for the month of February to establish a baseline. So we would look at February. What was your income in February? And then what was your income in April, May, and June? Okay. Proof that their income was affected by the COVID pandemic. And then we have examples of the layoff or reduction in hours. So we could have a person that was working maybe 2 jobs, a regular full-time job and a part-time job, and the part-time job fell through because of COVID. We would be able to, consider that person for assistance. We always look at the bank statements to look at their proof of income. So right now, they are telling us to look for the debit card, or those that are receiving income through the pandemic unemployment, the federally funded one, that they would be receiving $600 a week. So if you're receiving $600 a week, plus your regular unemployment, why aren't you paying your rent? That's what they'll be looking at. Unpaid leave to care for children. So some moms and dads had to, stay home because schools were closed and daycares were closed. So we are considering that. And unpaid leave or temporary disability due to the person being diagnosed or needing to, be quarantined because they might have been exposed to someone that was COVID positive. So we would need a medical professional to provide like a prescription, something that says that so-and-so, Joe Smith, was seen by me at this office, and we had to quarantine him for 14 days. So therefore, there was a loss of income. So all income documentation is very important. And like I said, we will be looking at bank statements. Okay. And that is it for me, I think. And that's a copy of the certification of landlord of arrears. Really easy, the first 4 numbers are actually what they have to fill out. They need to read the next to number 12 to make sure that that everything that they are saying there is true. All those statements are true. And then they sign and date it and get it to us. With a property tax bill, a tenant ledger as to their payment history, and a W-9. Okay. Next.
Thank you, Sara. Our next guest is Stephany Antonio from Hope House. Stephany is a case manager for the HPRP2 program in Morris County. So that's the Homelessness Prevention and Rapid Rehousing 2 program. She has been with the organization for about 6 months and new to the Morris County area. She previously worked as a case manager in Bergen County for a residential program that serves individuals with mental illness, many of whom were homeless, to assist in securing permanent housing. So thank you for being with us, Stephany.
Hi, thank you. Can everyone hear me?
Yeah.
Okay, great. Like Norwescap, our guidelines are pretty similar as far as the prevention piece. So the goal of HPRP is to provide temporary financial assistance and case management to obtain permanent housing. The two main focuses are financial assistance to pay for housing and case management services. We target currently homeless, that's under our rehousing, which is another category, and then individuals at risk of homelessness due to an eviction. So with that, the main guideline is to have a summons or an eviction. Right now, our prevention is on pause the last couple of months, just because, of course, we all know that they're not executing any evictions at the time. So it's been very difficult to do the prevention piece for the HPRP2 in Morris. So the maximum income, again, it is 30%. On the next slide, those are the income limits per household. It was actually just, it went up a little bit as of April. And again, that was when we were already started the pandemic. Next slide. Okay, so the requirements are you have to be a New Jersey resident and Morris County. So we could only assist families within the Morris County area. That 30% AMI for a household that lacks sufficient financial resources, are currently homeless or at risk. So again, the prevention piece, you would have to have a summons or warrant of removal, and then the legal status stated here. Again, if we are assisting with the arrears, the family has to be residing in the unit for at least 3 months without incurring arrears. A letter from a landlord is not sufficient. In case, if the case is closed, we can't assist with the back rent. But if the case is on default, we can probably try to assist. The best option would probably be relocation, that rehousing piece, but we would need a warrant of removal for the certification in the program. So a lot of it, sometimes it takes a little bit long, just because by the time the household gets to us, it's already a little bit too late. But again, the pandemic has really put a dent in that prevention piece, just because the grant hasn't made any amendments. We still would need that warrant of removal, or summons, I'm sorry, from the courts in order to assist with the prevention. But again, if anyone does have a household that, you know, wants to call us, I'm the case manager for this program, so I screen everyone that comes in. And that's pretty much it. I'm not sure if I have anything else. It's pretty straightforward. So one more thing, we do assist with the 3 months of back rent, and then if so the family qualifies, we do 3 months of arrears, and we can potentially do up to 3 months forward, as long as you know, the household is able to demonstrate future affordability. They have to show economic hardship, and they still fall within the income guidelines of that 30% AMI. That's pretty much it for the prevention piece. I think that's all I had. Thank you.
Yeah, before you take over, Allison, I wanted to give everyone some resources. So that the eviction program, this is the report to that program. This is the HUD webinar I was referring to. This is some more information about the Emergency Solutions Grant, research from HUD that showed being doubled up in overcrowding leads to homelessness more, and then some more HUD resources in an upcoming webinar, and then that is it.
Thanks, Nadine. Do you think you could take those links and copy and paste them into the chat box?
Oh yeah, I can definitely do that.
And while you're doing that, I'd like to open it up to any questions that anybody has. And again, just take yourself off mute. Everybody is, I'm not muting anybody at this point, so just take yourself off mute if you'd like to ask a question. You may also ask it in the chat box. Hi, Lenora. Yeah, I'm going to definitely send the slides out as usual. And don't forget, this is being recorded, so you can always go to the YouTube channel and just like kind of look for the part that you wanted to see again as well. But yes, we will be sending out a copy of the slides. if you are not normally on my mailing list, please send me a private chat with your email address so that I can add you to this list. There are a few people, I'm looking at the attendee list, a few people that I don't normally send emails to. So if you do want to get a copy of the slides, please send me your email address. Are there any other questions? So I had a question for Sara. The HPP program is a program you've already had, and then it's been updated for COVID. So are you not accepting any applications for people who maybe they were not necessarily impacted by COVID, but they do have rental arrears from before COVID happened as part of the old HPP program, or is it everything from COVID on, it's just changed everything?
Well, yes, we would be looking at COVID individuals that were impacted, but then we would have individuals that, let's suppose, when COVID hit, they were trying to apply for HPP, but they didn't have a court eviction. So we would have to wait for those court evictions to be, in place. So they have to receive the court eviction, and then it would be as normal. They would have to prove their hardship, they have to be within the income guidelines, and they have to prove sustainability. But yes, I will be doing the COVID individuals that were impacted, and I will be doing the regular ones also, plus the relocation.
So I just want to make sure I understood what you said. So for people who were not necessarily impacted by COVID, but just like they have, they have rental arrears anyway, they are going to be eligible, that granted that they meet all the other eligibility criteria, but they'll be eligible once the moratorium lifts and they receive an eviction notice.
That is correct. That is correct.
But for people who were impacted by COVID at this time, the HPP program is accepting a letter from the certification of arrears from the landlord for those folks. Gotcha. Thank you for the clarification.
Mm-hmm.
Stephany, I had a question for you. The HPRP2 program, is there an HPRP1 program?
No, I'm gonna try to answer as best as I can because I am new. But I believe before this is HPRP2, it's more new. I believe before this it was just HPP. So then the second part is HPRP2, which is the homelessness prevention and rapid rehousing. So the rapid rehousing is the second part that they added to the HPP. Because there was HPP, but they added the grant for HPRP2.
Okay, so there was never an HPRP1. It was just HPP and now HPRP. Okay.
Yes. Yes.
Thank you.
Mm-hmm.
I'm going to be quiet for a minute, see if anybody else has any other questions. So Nadine, I had another question for you. I was trying to understand what you were talking about at the very beginning. I know you said we were just talking about secondary homeless prevention programs at this time, but can you talk a little bit more about what a primary and a tertiary program looks like?
Yeah, so primary would just be reducing barriers that people become, that reduce the, let me start over, sorry. Primary decreases the number of people who ever become homeless. So that would just be decreasing or focusing on structural barriers that force people to become homeless. So that would be like increasing someone's income, or maybe having increasing the minimum wage. That would be a primary prevention strategy, or having affordable housing, a housing development that's affordable. That's a primary prevention. And then there's different types of primary prevention. But that's like, I think that one that I was just talking about is universal. And then tertiary, I think, would just be having a housing first model, and something that keeps people who are formerly homeless in homes. So case management, not having barriers that would make them lose their housing, et cetera, et cetera. Does that make sense?
I think so.
Yeah, so when we talk about prevention, like these kinds of prevention programs that Stephany and Sara are talking about would be considered secondary, because we're not preventing them from becoming homeless. We are preventing them, but they're already at the gate of our system. Like they need the funds now. Whereas if people were able to have livable wages that they could afford rent, that would be primary.
Gotcha.
And I can't share the link because I'm sharing my screen. So is it okay if I close this? Is everyone okay if I close the slide?
Yeah, go ahead and send it back to me. I'll make sure that I send out with the slide. Well, if I send out the slides, it'll have the contact information for you, Stephany, and Sara on it. Is anybody aware? Oh, please go ahead.
No, I was just saying, when you get the slides, all of the links will be connected. So you'll have the links that way too.
Perfect. So there's a lot of new money coming out of the walls, it seems like. Is anybody aware of any homeless prevention programs that we didn't talk about today? Carol, I don't mean to put you on the spot, but do you want to talk a little bit about the programming that you guys are doing for like mortgage and foreclosure assistance? And I apologize, I know I did not ask you ahead of time if you would talk about that, but I just noticed you were on the call and thought maybe you would be able to speak about that. Okay, so maybe either Carol walked away or she can't connect to the audio for some reason. So if there are no other questions, we can go ahead and end the training. Again, if anybody has any questions, now is the time to ask. If anybody has any other resources to share, this is the perfect time to talk about them.
Hi, just to add something else, if any provider here has a client or a family they would like to refer to us, because Hope House, we do have a couple of other programs, they can call extension 3038. I believe my contact information was on that last slide for my direct extension, but for the households that you're referring, it's extension 3038. I'll write down the number and extension on the chat box.
I have a feeling, Stephany, that once this moratorium lifts, you're going to not have any problems getting the clients that you need to fill your grant requirements. So, yeah, David, please. You never have to ask. Please say quickly.
Well, thank you. I appreciate that. So I think what I want to try to say is this. My name is David Saltzman. I'm from Legal Services of Northwest Jersey. Landlord-tenant court is in Morris County every Friday morning. Myself and usually 4 or 5 other attorneys, as well as support staff and paralegals, come to court to try to assist those who need assistance. We prefer when folks call us in advance so we can gather documents and gather facts and get the appropriate law, but we take walk-ups as well. And I just want to suggest that, look, sometimes we don't have a lot of good advice for folks, but I think right about now, sometimes we do some things that might be able to buy some folks some time. And I think that for the financial resources that are available to almost anyone at this point, it's going to take some time to work through and get those financial resources. So yeah, I'm submitting a plug for my firm, and I acknowledge that, but I also want to suggest that, you know, if there's a deficiency in papers that for the clients when they're in landlord-tenant court, maybe we can buy them some time. And here, there's an old saying in landlord-tenant court, time is a tenant's friend. And so if we can buy them some time so they can get the money and to get everything together, you know, please send them to us. You know, at worst, we can just talk to people, but at most, sometimes we can buy people sufficient time in order to get the money to put everything together. And so I guess that's all I want to say. Thanks.
Thank you, David. And yeah, and so just so everybody knows, Stephany did put her phone number and extension into the chat box. We will email it out as well. And yeah, David's right. I mean, I think one of the things that we're going to be doing in the next couple of weeks is putting together sort of a plan or a process for when people are coming to us and they are in arrears or they are having trouble, or they have an eviction notice once, you know, like I said, once the moratorium lifts, and landlords are going to be eager to start that process, that when that happens, and we have people who are entering this crisis phase, we will be able to have very concrete steps of how they can go through the process so that we are buying them as much time as possible and buying ourselves as much time as possible and maximizing the resources that we do have at our disposal. It seems like a lot of money right now, but we know how quickly the money can run out when you have a lot of people with a lot of needs all at once. And so it's going to be really important, more important than ever, that we work together in a system to, again, maximize the resources and to keep all the tenants calm through the process as well. So that said, I think that's a really good place to end. Working together as a system is a good place to end. So thank you so much. We are having a CAS conversation this Friday at 10 o'clock a.m. So if you are not on our normal mailing list, again, and you want to be reached out to with the information, I already got a few people sent me their contact information, so thank you. But if you haven't yet, please do so, and I can send you information about the CAS conversation as well. That conversation is going to be around reopening. We're going to have 4 speakers, including myself, and then plus time for sharing, for agencies to share what their organization's reopening plans are, or if they started to reopen things, what those things, what that looks like. So please join us for that conversation. And I hope everybody has a great week. Thank you so much.
Thank you.
Thank you.